A topic that I like to discuss with all of my patients or future patients is actually what to expect when you first come and see an OBGYN, and me specifically. One of the biggest transitions in your life is going from seeing the pediatrician to actually stepping up in the world and seeing an actual OBGYN, and more specifically on the gynecology side. One thing that I would like to stress is that all of it is education and a discussion. So girls can come to see me as early as 13 when we're starting our first period, or if we're not ready until we're after 21, that's also okay. The biggest thing that I would like to stress is that it's all about safety, a place where we practice talking about maybe sometimes some uncomfortable topics, but also practicing to have a real medical relationship with a doctor without supervision of mom or dad. Very normal to have a nice full history, tailored both to when parents are around to kind of fill in those little gaps that we don't really talk about. But always I will ask a parent or guardian to leave in the room so we can have one-on-one private time. It gives you a place where you can talk about all the things you don't want to talk about, like sex, drugs, and rock and roll, things that are important about your safety, and I will also teach you when it is okay that something happens and when something is not okay. Social media brings up lots of topics. It brings up more questions for all of our patients that come by and see me. All I ask is you ask the question. Let's talk about it. Let's talk about when someone brought up a papaya and how it can help your skin or vaginal health. Let's talk about eating dates or prunes and maybe the negative side effects of it. The only way that we're going to get true information is if we talk it through, and I just ask no judgments at all, but let's have a full conversation from the beginning to the end. Pap smears are a topic that always come up when they see a gynecologist. A pelvic exam and a pap smear is not indicated unless you're over the age of 21 and also sexually active. None of the examinations that you should be experiencing before that time should be anything that's pushing you into it or too sensitive. So again, we have those uncomfortable conversations sometimes, but it all tailored to whatever our exam is going to be. Now, the topic of birth control and hormonal control and periods, medications that can help, prevent you from suffering from terrible monthly periods and feeling crummy and having bad mental health can be treated with hormonal control, and you don't have to be sexually active to be a candidate for it or a patient that'd be good for taking it. Not only am I excited to meet all of my new younger patients, but I do like to stress that I will see women of all ages with all different diagnoses, any issue related to both obstetrics and gynecology. One of the best parts of my job is that I get to be a part of your journey from young age to when we're at a point where we don't have to worry about periods anymore at all. I stress a lot about preventative care and physical and mental health wellness. So I am excited to meet you all and hopefully bring you into the Hill Country family.